Hello and welcome to this week's episode of Clinic Conversations, and this week we are back with Dr. May, rheumatologist here at Rapid City Medical Center. How are you, Dr. May?
Very well, thanks.
So today we're going to be talking a little bit about arthritis. So do you want to just lead us into what arthritis is and the definition of arthritis?
Well, arthritis is a general term. Obviously, generally it means you have joint pain, but essentially there are two categories of arthritis. There's inflammatory and non-inflammatory arthritis. So inflammatory arthritis is more immune system mediated arthritis, and that's more what I take care of as a rheumatologist. And then there's degenerative arthritis or osteoarthritis, which we call non-inflammatory, which technically the immune system isn't the mechanism for the joint pain. So those are sort of the two categories, but essentially it's joint pain and stiffness.
So what's the most common form that you see here at the clinic?
Well, again, as a rheumatologist, we focus predominantly on inflammatory arthritis, although we do take care of both types. The most common type of inflammatory arthritis we see is rheumatoid arthritis, which is probably what most people are familiar with. That's an arthritis that involves the small joints of your hands, wrists, feet, and ankles. But we also see psoriatic arthritis, reactive arthritis, and several other types of inflammatory arthritis.
Is there a certain way that you generally would treat the symptoms of arthritis, or how do you go about that?
So again, the treatment depends on the mechanism of arthritis. So if you have an inflammatory arthritis, which again is an immune system mediated process, and that's majority of what we manage in rheumatology, we're going to treat that by manipulating your immune system or turning down the volume on your immune system so that you have less joint pain, stiffness, and swelling. And it's not a curable problem, but it's very treatable, and we can usually make people have significantly reduced symptoms or minimal symptoms with treatment. Degenerative arthritis or a non-inflammatory arthritis is a little bit more challenging to treat, but topical rubs, anti-inflammatories, local steroid injections, and sometimes surgery are the way that we approach that type of arthritis.
All right, is there any specific diet that patients should be following if they have arthritis?
Patients always ask about dietary changes. In general, the diet I recommend for my rheumatoid arthritis patients or my arthritis patients is the same diet I would recommend for anyone, which really is a diet that's low in processed food, low in added sugar, that has whole foods, so whole fruits, whole vegetables, and that is what we all should do, but that does seem to help people be more comfortable. Beyond that, there are many non-inflammatory diets that are promoted that aren't really have any literature to support them per se, but sometimes people will note some improvement on them, but I don't really recommend people go spend $300 for a special diet or special drinks.
Are there any other lifestyle changes that patients with arthritis should make?
Well, yes. In general, we know that smoking is a risk factor for rheumatoid arthritis, and smoking sometimes makes the disease more difficult to manage, so we encourage all of our patients to not smoke. Also, weight control. So again, sometimes if you're real heavy, it can be more challenging to get your arthritis under control. And so again, kind of eating a more healthy diet, getting quality rest, exercise, being active is important in managing the overall disease process.
Is there a best time for patients to seek out help for arthritis, and if so, when is that?
Yes. Inflammatory arthritis like rheumatoid arthritis, ideally we would want to see patients with those symptoms very quickly, within the first 3 months of symptom onset. Currently, patients with inflammatory arthritis sometimes take a year to be identified and referred to a specialist. So if you're having symptoms of joint pain, stiffness, prolonged morning stiffness, an hour or two just to loosen up, obvious swelling, we don't want you to put that off. We want you to be seen.
What's the best way for listeners to find out more about arthritis?
Well, of course, there's lots of information on the internet, and a lot of it is not validated, I guess is the word I would use. So I really encourage my patients to go to really supported resources like the American College of Rheumatology's website, which is rheumatology.org, has great patient information as well as resources regarding the medications we use, side effects, etc. And I also recommend Mayo Clinic's website. They have lots of great information on arthritis, health, diet management, and there are valid resources. We can trust the information that people receive from there.
Okay, awesome. Well, thanks so much.
You're very welcome.